As of 3rd September 2018, Congo has recorded a cumulative total of 122 cases. 91 have been confirmed and 31 are probable. They've recorded 82 deaths, 51 confirmed and probable 31, indicating a case fatality of 66.4%. These cases are coming from North Kivu and the Ituri provinces in Congo. 8 cases currently are under admission, with 3 pending laboratory confirmation. According to reports from Congo, the situation is being exacerbated by sporadic instances of high-risk behavior, including unsafe barrier practices, reluctance towards contact tracing, vaccinations, and admissions to Ebola treatment centers, poor infection control practices in some health facilities, and delayed health-seeking behavior. The global health community, including the Africa Center for Disease Control, of which Zambia hosts the regional center for SADC, World Health Organization, among others on the ground, are there to support the Democratic Republic of Congo in containing and mitigating the outbreak in the areas affected. I might take this opportunity to give a bit of details about the rumors that have been circulating on social media. I want to inform the public that contrary to the news circulating on the social media, there is no case of Ebola virus disease in Zambia. Yes, we have admitted a patient at Levi Manawasa Hospital who is a 41-year male-old suspect, a resident of Serengeti district, who came to Lusaka for a church meeting on 27th August 2018. He was already ill on travel, and he presented with fever, discoloration of the skin resulting from bleeding underneath the skin, and red patching in the white of the eye, among other symptoms. This patient was admitted and quarantined to rule out EVD. This is important. It means that our surveillance system is alert enough to pick cases that are suspicious, and so this patient was quarantined. On further investigation, our health workers made a tentative diagnosis of septicemia, which is a condition where there's a bacterial infection in the bloodstream. Further, our laboratory investigations conducted at the University of Zambia School of Veterinary Medicine, the diagnosis of Ebola virus disease was ruled out completely. I must indicate that we're pleased by the response from the media, and I would like to encourage the general public to maintain such high levels of suspicion, because surveillance relies on suspicion. The level of alertness must be increased, must be escalated, to ensure that any suspicious case is reported. So when you hear such cases being reported in various facilities, we are not reporting cases of Ebola. We are actually demonstrating the alertness, the sensitivity of the surveillance system. I therefore want to urge you colleagues in the media to work with us in communicating verified information to the general public. The levels of alertness in the community, like I said, are encouraging, and it is our aim that our event-based surveillance system be highly sensitive. The public must be able to detect and quickly notify public health authorities on any suspicions of illness and deaths in the community. I further urge our people in the public to ensure that any suspected cases access health services at the nearest facility. Members of the press, distinguished ladies and gentlemen, the ministry has continued to prepare for any eventuality. We've conducted training of rapid response teams, and along the borders, in the provinces Northern Province, Luapula, we've already trained 7 rapid responders per district and per province. And tomorrow we are commencing training on the Copper Belt. And furthermore, we're moving to Northwestern Province. This is to ensure that the rapid response teams are ready. As we speak, the previously trained teams have already been triggered. We have been reinforced in our training by our colleagues from the Center for Disease Control of Atlanta in America, and they are working with us in escalating the level of preparedness through training. Our disease intelligence wing continues to be alert. Under the Zambia National Public Health Institute, surveillance and disease intelligence activities have been escalated, and various mitigating and preventive measures that I shared with you 2 weeks ago are in place. Now, the government of the Republic of Zambia, being the host country for the Africa Center for Disease Control in the Southern Africa Regional Collaborating in the Southern Africa region, working through the National Public Health Institute, is working together with member states to ensure that levels of preparedness are enhanced in all the regional countries. We are sharing through the ECHO platform every Wednesday information of what's happening in various countries, and we are helping each other to ensure that levels of preparedness are improved. I wish to remind you, members of the press, that Ebola virus disease is a highly contagious disease that is caused by Ebola virus. It will commonly present as fever, severe headache, muscle pain, weakness, diarrhea, fatigue, vomiting, abdominal pain, unexplained bleeding, and these symptoms may appear anytime between 2 to 21 days after contact with the virus. Although a rare disease, it is very severe and often deadly. Finally, I take this opportunity to assure the nation that all is under control, considering that the government of the Republic of Zambia, under the leadership of His Excellency, the President, Mr. Edgar Chagwa, has taken all the necessary measures, including heightened surveillance, heightened prevention, preparedness, and response activities against Ebola. We will continue updating the nation in the event we have any new information. But for now, the suspected case that is at Levy has been ruled out completely as a case of Ebola. And surveillance is held for being alert, picking out the suspect, especially that the symptoms, yes, did mimic, Ebola. So thank you.
Thank you, Honorable Minister. Members of the press, you have an opportunity to ask a few questions, if there are any questions where you need clarification. Do you see any hand for any question? Yes, please.
What is government doing to ensure that the surveillance systems in the country's border posts, especially Kasumbalesa border post, is heightened to prevent these cases from escalating into Zambia?
Do we have another question? Honorable Minister.
Thank you very much. Whatever interventions we're putting in place are in alignment to the international health regulations. And at this stage, we do not encourage stopping of people crossing into the country at such borders. So what we have escalated instead is surveillance at all ports of entry, including Kasumbalesa. And furthermore, cross-border surveillance activities are being strengthened. So we're working together with our colleagues in the Congo and with World Health Organization in Africa, CDC, to ensure that we strengthen cross-border activities. But Zambia is a party to the international health regulations and will not practice anything that is outside the tenets outlined in the IHR.
Natasha Morrow from EBS Radio. Have you any plans of maybe carrying out vaccinations as a preventative measure, as opposed to just carrying out surveillances?
The interventions that we carry out are commensurate to the threat and to the situation that is existing at that time. And at this stage where we are now, what is effective is escalated surveillance. What is effective is mapping any possible threats. And it is important to note that right now, we are not at a stage where we need to start vaccinating people.
Okay, I see no further questions. Honourable Minister, thank you again for the time, and members of the press, thank you. We continue to cherish your collaboration. We call the meeting to a close.
Thank you.